Uso anin skasay kalingan sinabi mina nugong ikakano na nagogoya kasi de baya magak nimna gagoy chami goy nugong chang kwam sik musko zi chon chakana me gwagi ke kawat mina ke mashaya kano ene mige idana we maga niwa ugna ge badu chiok hangwam seda musko zida. Today is Wednesday, April 15, 2020, and there are 0 confirmed cases of COVID-19 on the Red Lake Reservation. Statewide numbers are as follows. 40,242 have been tested. 1,809 have tested positive. 940 are no longer in need of isolation and on their way to recovery. 87 has passed on. The story of the winter, Bibun, fighting spring, Sigwan, is about the balance we bring to one another. And turning spring is a sign of renewal for us. Our stories are a reminder of why we must continue to come together to protect our loved ones from this historic health crisis we are facing. The Red Lake Tribal Council has been working extensively with IHS, Red Lake School Systems, and the emergency response team to plan for if and when COVID-19 makes it to the reservation. Today we have Noreen Smith, Chief Executive Director of Indian Health Services, Red Lake Hospital, as well as Melinda Crowley, Superintendent of the Red Lake School District. Joining us to give an update, I'll pass it on to Noreen first.
Good morning. My name is Noreen Smith, and I am the Chief Executive Officer of the Indian Health Service Hospital here in Red Lake, Minnesota. The Red Lake Hospital has an ongoing emergency preparedness plan that helps the hospital prepare for a variety of unexpected events. One portion of the plan is a panoramic response plan. The hospital has been focused on COVID-specific preparation since January 20th, 2020, with a comprehensive plan finalized March 9th. The hospital activated the Emergency Incident Command structure officially on March 16th. Since that time, the hospital has increased planning efforts and internal preparations to respond to the emerging virus threat. We quickly set to work the inventory supply of personal protective equipment for staff and to purchase additional items. Today, we have a 6-week supply of the personal supply items to support potential hospital surge. We have increased staffing training, community education, and outreach activities to reduce transmission of the virus. We have also changed some internal processes such as screening at the hospital entrance, pharmacy curbside delivery, changed waiting spaces, and increased hospital cleaning and disinfection. We have also created an Ask Nurse telephone triage line to provide education, and we have a process to conduct telephone visits with providers. We have also increased our inpatient admission capacity. Testing is the key to stopping the spread of this virus. We have worked hard to improve access to COVID testing, and we hope to have internal lab testing by Friday of this week. This will reduce the turnaround time from testing to under 2 hours versus 4 days. Right now, we send our testing to Mayo Clinic, and it takes approximately 4 days for us to get the results back. What we have right now is we have purchased a new machine so that we can test and we can have results within a shorter time period, hopefully within a 2-hour time period. We have set up a parking lot testing to streamline this activity. Patients that have symptoms can contact the nursing screening line at 679-39112, option 1, to discuss testing availability. We have been preparing with community programs for the past month to deal with the potential impact of the virus. We are prepared, we are ready, we are here for you and your family. Again, we are ready for you to come back to the hospital, and please come and see us. We will continue to provide the care for you. We will continue to, if we need to send patients out, we will be sending patients out. We have the systems in place for that to happen, and we also have the system in place to basically take people out by helicopter. So those are still the things we're still in full operation at the hospital, and at the same time we are in the process of setting up so that we would be able to treat patients if they come down with the virus. Thank you.
Now I'll introduce the Superintendent of Red Lake District 38, Melinda Crowley.
Bonjour. I'm very pleased to be able to be here and speak to you today on behalf of the school. Thank you, Chairman, for inviting us. We have been working together a great deal over the course of this time. The teachers took 2 weeks to plan distance learning, and right now we've had a lot of it going on really, really well. Our 9th through 12th grade are working on computers from home, and Paul Bunyan Communications and the school district and the tribe came together to make sure that everyone had access that needed it, and if anyone still needs access, please call the school. We'll route you to the technology department so we can work on getting that for your students. One of the things about distance learning is that students are asked to check in every day with their advisors. And so we're doing check-ins both with student advisors on academics and also with student advisors on any mental health needs families or kids may have. At the ECC building, we're working on doing a lot of Ojibwe Moan and having our children learn different words and putting up videos. At the end of this, you'll see that I put a link to a video that one of our staff members at the Early Childhood Center has done to make sure that our children learn some of the words around maple sugar camps, etc. This is done by Wes Jourdain, and he will continue to do them throughout the time that we're doing distance learning as a resource for everyone. At the elementary school in Red Lake, we're really busy delivering meals daily for around 900 children. In Panema, we're delivering about 250 every day, and at the middle school, we're delivering about 450. So we've got a great deal of meals that are going out, both breakfasts and lunches, and we are continuing to do that with the help of our bus drivers, our paraprofessionals, our cooks, our custodians, all of the people who really take pride in what we're doing in Red Lake. And so they're pulling together on the food service end of it. Our teachers are pulling the distance learning pieces together. Interesting fact, through the distance learning time, our check-ins have increased, and so our attendance rate is up close to 90% now daily, which is wonderful. So keep doing that, keep checking in, keep trying. If there's anything you need, please check and see with the school. We have different resources that are available. We're working on getting iPads out to our alternative day students. And so if you're a student that's in the ALC program or in the alternative day program, please make sure you contact the school so we can get you access to curriculum so that you can graduate on time also. We're using the Acellus curriculum, and so you should be able to get all of the credits you need met. One of the other features that we're doing is we've been starting to work with some online mental health earlier in the year. The gentleman who is the provider for that has extended that offer to students and families via technology, and so if you're interested in that, please contact the school and we will get you set up for that also. One of the really fun things that happened is that this spring we were able to have the Maple Sugar Camp. It's been amazing. We have wonderful video that was done. Unfortunately, a lot of our kids didn't get a chance to come out, but we made up for that by taking videotape of everything that was happening out there, and we're putting them together in learning modules that will be then distributed out so that families can see them also. One of the things that happened, you always get some bumps in the road, and there was a little bump in the road at the Maple Sugar Camp that was, actually had been put out on social media. But the reason I mention that is because one of the wonderful things that happened from that is the entire community banded together and helped and pulled that together so we could continue to do the good work out there, and we could continue to harvest the sugar and get treats and candies. They've made sugar, they've made syrup, and we'll have that for gifts for people who come to help at the school. We also have some really neat things happening with our school elders. Susan Johnson, Arnold Kingbird have been working on elder programs for our kids for a long time. Now that we're in distance learning, we can't have them in the classrooms the same way we have. So what they've been doing at home is every day they're putting together at least 4 stories in Ojibwe and recording them. And we're taking those and archiving them so they can be teachable units for our kids as we move forward. In addition to that, the district has worked on producing 4 children's books. And those will be produced through Tom Peacock and his publishing company. And they will be ready this spring for distribution. We will be putting them out on the website too. There are several locations where we've had our teachers telling stories for the kids, so if your children get bored at home, feel free to take a look at that. I even have one that's out there that is pretty ridiculous. So that's one of the things going forward. In addition to that, we're preparing a curriculum called Dream Navigators, and that is a career and technical ed program that is based solely in Red Lake tradition and history. And the stories in it are all Red Lake, the pictures are all Red Lake, and it's supporting how we want our children to move forward and have that career and college readiness that we need to have. Again, circling back, everyone's worked together. We're all pulling together right now. We appreciate the support. I rode the bus the other day and delivered meals, and it was wonderful to see all the smiling faces and the happiness that's out there. Please continue to have your children keep turning in their work, whether it's paper, pencil, or doing it online. Make sure they're checking in, and if you have any needs, let us know. And like I said in the beginning, West Jourdain has a great video out. The link will be on here. Please take a look at that. Have a good day. Gigawabaman.
Thank you, Chimigwich, Noreen, and Melinda, for your updates and getting this information out to our members. It is vital during this time that we are practicing all the phases set in place by the Tribal Council, which are curfew, shelter in place, medical martial law. As you travel or if you need to go somewhere, wear your face mask while in public, social distance at least 6 feet from others, practice the hygiene recommendations from the CDC, and if possible, purchase your items on the reservation and limit your travel to essential needs only. The phases we have set up for you, for all of you, please follow the steps that we have put. And I kept saying this to you, and I'll keep saying this. Please, stay safe, stay strong. Take care of your families, your relatives, and the vulnerable, especially our children. They are very important. Famous prayer of thanks by Chief Seattle. Every part of this earth is sacred. Every shining pine needle, every sandy shore, everything in the dark woods. Teach your children that the earth is our mother. As whatever befalls the earth, befalls the children of the earth. We are part of the earth. The earth is part of us. We belong to the earth. This we know. All things are connected, like the blood which unites one family. All things are connected, for we did not weave the web of life. We are merely a strand in it. Whatever we do to the web, we do to ourselves and to our children. Let us give thanks for the web and the circle that connects us all. And I want to thank you and say Chimigwich to all of you, for everyone that's listening, because it's all about you, it's about your children, and you take care of yourselves.